Hey guys, it's Chelsea from Live for Lolly, and sorry about the informal video scene here for you. I'm coming at you in my car because I've got some really important news to share, and it's just really important that we tell you sooner rather than later. I'm sure you guys have already been paying attention to the news and are aware that the White House is proposing to defund the Office of National Drug Control Policy. And if you're not familiar with their work, well then you may be living under a rock. They basically help us with our drug-free communities programs. Gosh, we have so many all over the United States, but some really impactful ones here in Illinois. They also fund the high-intensity drug trafficking area groups that help us to identify hot pockets of drugs and identify kind of those higher potency drugs that are hitting the scene. They help us with law enforcement strategies, and they've been doing that for quite a number of years now. The ONDCP, really without them, we could not have achieved what we've been able to over the last 10 years of making addiction an important issue, making people care. They've really just been kind of our advocate. They've kind of been the liaison between the advocates and the White House, and they've done that so graciously. Without them, it's not up to me what happens. But the reason that this is so important right now is because the opioid crisis and other mental health issues hit a really big turning point this week with the passing through the House of the American Health Care Act. I mean, those pre-existing conditions are important. I have about 7. I don't know how many you guys have, but mental health issues is one of them. And without that coverage, I guess I'm wondering how we're going to be able to treat people. I'm wondering how people are going to be able to get affordable care that's evidence-based. I'm wondering how we're going to be able to get medication-assisted treatment into people's hands as openly as we know the data is telling us we need to. I'm wondering how we're going to be able to get naloxone into the hands of people who need it. When you're in the middle of an opioid crisis, you don't pull out care, you don't pull out access to care, you don't pull out overdose reversal drugs, and you certainly don't eliminate the groups that are actually doing the prevention work and the work to identify the drugs that are actually existing in the areas that they exist, so that they can work cohesively with law enforcement to keep us safe. No matter what you think about the way that our policies are developed, everything right now serves a purpose, and when you move one out of the equation, it's like a teeter-totter effect. It's going to cause massive problems. This is a huge problem. If the Office of National Drug Control Policy gets defunded, I really truly fear for what's going to happen. And I'm not just saying that to scare all of you. I'm really saying that because it's a legitimate issue. President Trump said during his campaign over and over again that he cares about the opioid crisis, that he wants it to make it a key piece of his mission of creating change while he's in office. And everything that keeps coming out of the White House and the Republican Party is that they don't care about mental health issues. And that's a huge concern. It's a huge concern. It makes all the work that Live for Lolly and Shatterproof and Facing Addiction and Not One More and Addiction Policy Forum and all the work that we do irrelevant. It makes it puts it at great risk. If you eliminate care, people are going to die. It is that simple. So what we would like everybody to do, if you can, is please contact your member of Congress and your senator, and please let them know to do whatever they can possibly do to advocate for the funding of Office of National Drug Control Policy. Don't get me wrong, I think that we should be putting our money into other things like harm reduction efforts and things that the data are showing us would be more effective. But taking away that funding is really significant. Please call their offices locally and in DC. And if you'd like, we can help you. We're going to be sending out an e-blast shortly, kind of with some instructions. But really, this is a time to advocate. Between the healthcare crisis in general and this crisis, I don't know how much worse it can possibly get. 144 people are going to die today from an overdose. So really my final message with all of this is is the piece about law enforcement. You know, a lot of what's coming out of the office right now, the White House, is that they want to bolster up law enforcement. Don't get me wrong, I love our police. They have gone above and beyond to make people safer. They have jumped on to strategies that they can do to try and nip this epidemic in the bud as much as they can, especially our police in Illinois. They are unbelievable what they have been able to do with diversion, deflection, naloxone administration, trying to figure out ways to not incarcerate but help people. It's amazing. But they are not psychiatrists. They are not social workers. If you're going to put money into making them psychiatrists, you're not going to find a lot who are going to want to do that. It just doesn't make any sense. The systems work the way they work for a reason. People specialize in these fields for a reason. While I think putting money is important into our law enforcement, I truly feel that taking it out of healthcare at that, for that reason doesn't make a lot of sense. How is it in 2017 that we are actually having this discussion? So clearly I'm very upset. The whole Live for Lolly team is really upset and worried. Call your congressmen, call your congressmen and women, call your senators, talk about this problem. It's not going away, and one of the reasons it's not going away is because we have people in office that aren't advocating for us. That's my message for the day. If you guys have any questions, please reach out to us. We're here, liveforlolly.org, 844-584-5254, and thanks for tuning in.